the Honorable Deputy Minister, Dr. Zomo, Deputy Minister of Health, to Mtwana ukhona lapha endlini, uPrince Gazolithini, to the MEC, I don't know if MEC selekhona ekhaya, kodwa sombingelela noma engekho, uMr. Magugu Smelani Zulu, to Ms. Teliwe Madlopa, who's MPL, welcome. To our dear friend and partner, Professor Ramniki Alwalia, to Dr. Nzimande, who's also a partner in higher education and training, members of management at the University of Zululand, to special people of today, Dr. Ngogazi, for leading this team, with Sister Hlengi Wezulu Mkonazi, distinguished guests, students, representative council members, and students of this university, ladies and gentlemen. It gives me great pleasure to welcome you at our university. The visit is significant in that it comes at a time when we are trying to come into terms with the new reality of having to live with COVID-19. Indeed, the most optimistic amongst have begun to talk about post-COVID-19 dispensation. In truth, such a reality does not exist. It can only exist when the virus has been expunged. For now, we have to think of a transition from a pandemic to an endemic presence of the virus. Your visit, coming from different departments, is a testament of connections and synergies that had to be considered and exploited in our attempts to deal with the pandemic. The synergies were perhaps best expressed by the Department of Higher Education and Training, pay offline, when it declared that our challenge in 2020 was to save lives and to save the academic year. Your visit only serves to confirm the enduring relevance of that characterization. It is no exaggeration to indicate that it is in times of such crisis that the fault lines of our existence becomes glaringly exposed. The inequalities stand out for us like a sore thumb. The poorest of the poor in our country bore the ravages of the pandemic. For instance, social distancing meant nothing for those that live in congested conditions of squalor. We lost many due to the lack of understanding. Initially, our own employees, especially the support staff, assumed that the pandemic affects those who travel by plane. To a certain extent, it is true, since these exposed to large surface area. But this was in part of reporting that they were receiving from the media space. As a university, we took a break and we reflected on what does it mean to talk about social distancing, putting on a mask to our aunties and not databe, to our Sebenze Garden. When we realized that, in fact, everything that is said in the social space and media was said in English, we had Sister Mkonazi, we had Mr. Nantlego to say, take them to this hall and interpret and translate the material that we have about the pandemic. That's when we realized that, in fact, their understanding was that this is a disease that only attacks people that are traveling by planes. They said, does it mean we can also have it? These are the realities of our country, and we should not underestimate the lack of information and the lack of understanding of our people. And what hit me hard was an understanding that this is there was the same story that happened during the HIV/AIDS, Professor Ramnik, that our people were misled, they couldn't understand what was happening, and we all had all kinds of myths, and even with this pandemic, the same story was going to happen. Deputy Minister, Honorable Minister Thomo, it is only when the ministers, I watched it myself, in the media, were speaking in African languages that the message got through. I'm highlighting this particularly to say we should not exclude our people when we are hit by a crisis, and we only run with people that understand what each crisis or pandemic means. We have got to all the time think about our people and say they should never be left behind. So we cannot talk about our challenges without placing these in our cultural context. This brings me to the object of today's discussion around broad challenges of health that our youth are also facing. These are challenges that are intrinsically linked to the country's social ills. Yes, Professor Siepe in his opening remarks said, we've got to come to an end doing things for our students or with students, but allow our students to be part of what we are trying to achieve. The statistics are damning. We understand that up to 30% of new HIV infections are attributed to the youth of our country. There has also been an increase in teenage deliveries, which is shocking, including young people as early as 10 years and 14 years that get pregnant. I will try and hold my breath when I come to this, because the question is, I had a joke, Prof Moyo will know this. I had a professor that I thought, if you are to ask if this person supervises students about teenage pregnancy, and one of the research questions which we laughed until he passed on was the question he came up with a student how do people get pregnant? My question is, who makes a 10-year-old pregnant? And I was saying to Prof, is it not given? How can you say this is a research question? Don't you know how people get pregnant? My question to this generation, Deputy Minister, really is, who makes a 10-year-old and a 14-year-old pregnant? We need to talk. As if that is not bad enough, the youth has to navigate through the scourge of gender-based violence. Sadly, some of these have resulted in these pregnancies that we are talking about. I couldn't agree more with you that nothing short of holistic program will stem this tide like we are engaging today. And universities are better placed to be part of the solution to this health challenge facing our young people. After all, most of the young people from the ages of 20 to 24 are to be found here at the university. Now I want to move on and talk to the approach to health. Our point of departure with regard to health is informed by the World Health Organization's definition of health as a state of complete physical, mental, and social well-being. In this regard, we take the view that being in good health should not be equated to the absence of disease or infirmity. Some of the challenges faced by our youth are psychosocial. In this regard, reproductive health is about ensuring that people are able to make responsible decisions as it relates to their reproductive health is concerned. It means that men and women ought to be informed of and to have access to safe, effective, affordable, acceptable methods of birth control. Also, access to appropriate healthcare services of sexual activities or engagement. Reproductive medicine and implementation of health education programs to stress the importance of women go safely through pregnancy, childbirth, could provide couples of best chance of having healthy infant. I close that quote. The university's clinic offers comprehensive services to all its students. Prof. Siepe has already indicated that we have got a sister here who's a true nurse at heart. All she wants is to change UniZulu as a university to university hospital. The provision of these services is to cater for all students with full knowledge that some of them come from areas that are underserved. We have ensured that the university clinic is easily accessible. These include interventions that are short-term, medium, and long-term. The aim of such offerings is to stem the tide of unwanted and unsafe pregnancies. Be that as it may, data emerging from neighboring clinics and hospitals seem to suggest that the teenage and youth pregnancy have become a pandemic in our society. To give you a glimpse into services offered, it is important to indicate that since its inception, Campus Clinic Health Clinic has offered the following adolescents and youth-friendly services. That clinic is forever busy. There is syndromic management of STIs, the HTS, HIV testing and counseling, there's family planning, sexual productivity, health and rights, voluntary medical male circumcision, condom distribution, there's tuberculosis screening, there's anti-retro treatment rollout, pre-exposure prophylaxis treatment, post-exposure to treatment, HPV and abuse awareness, mental health services, substance abuse awareness, COVID-19 screening, COVID-19 vaccine mobilization, COVID-19 vaccination, blood pressure screening, diabetes screening, cancer screening, minor medical and surgical ailments treatment, medical emergency services. Tell me, DM, if we are not a hospital. We are a mini hospital. We are pleased that your visit involves, among other things, drawing to our attention the extent to which the scourge of young youth teenage pregnancies afflicts and affects our communities. You'll find in us a worthy partner in this regard. Sister Mkonazi is in the attendance to answer any questions, Dr. Romo, as Deputy Minister of Health, you might have as to how have we translated a university into a mini hospital. And it was not because we could afford. It all came because of where we are and that realization that we are serving students that come from environments that might not have had or rendered the services. So education about health and health services has been key and important for our young people. So thank you very much.